agenda is the confirmation of chair and vice chair. I will go ahead and chair the meeting for the start and then hand it over after we deal with item 1. So just a few reminders for anyone participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put your phone on hold. Please avoid using speakerphone when speaking, and please speak directly into your device's microphone or your telephone receiver. I'm going to conduct the roll call. Member Banham?
Present.
Mom Cloutier?
Present.
Member El-Shantiri?
Present.
Member Gower?
Here.
Member Kavanagh?
Here.
Member Lakin? I'm not seeing him yet. Member Menard?
Present.
Member Pinel?
Présent.
Member Tilley?
Present.
Vice Chair Di Giovanni?
Present.
And Chair Aglai.
Here.
So we have quorum. Are there any regrets in for this meeting? Hearing none. The Zoom meeting procedures. So the following procedural guidelines are being implemented to promote orderly proceedings of this virtual meeting. Should members need to leave the meeting, they should advise verbally that they are doing so before clicking on leave meeting from the Zoom platform and ending their call if participating by phone. The chair will provide each member with the opportunity to ask questions or comment. Members will be called on to speak in the order set out in the board secretary's voting list, alternating between alphabetical order and reverse alphabetical order. The usual 5-minute limit will apply. Should you not wish to speak or on a given matter, you may decline verbally when your name is called. If a full recorded vote is not taken for a given item, the chair will specifically ask if the item is carried and then call for dissents to ensure that all votes are properly registered. Procedural interjections should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order, when you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Should any technical difficulties or unforeseen matters require a recess during the course of the meeting, unless the board secretary issues new instructions, members are asked to stay on the line. The board secretary will mute all participants in such an instance. Are there any declarations of interest? None. Can we confirm the minutes of the meeting of November 30th, 2020?
Confirmed.
Okay.
Confirmed.
Thank you. We have 7 communication items as listed on our agenda received.
Received.
Dave.
Thank you. Member Banham, can I get you to move the motion to introduce reports, please?
Yes. Be it resolved that the report titled Confirmation of the Chair and Vice Chair, the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled Lessons Learned Working with Long-Term Care Homes During the COVID-19 Pandemic, COVID-19 Pandemic Response, Looking Ahead and Building Back Better, and Ottawa Public Health Strategic Plan for 2019 to 2022, 2020 Year in Review, be received and considered. And be it further resolved that the rules of procedure be suspended to receive and consider the report titled Ottawa Public Health Submission to the Government of Ontario on 2021 budget consultations, given the submission deadline of February 12th, 2020.
Is that motion carried?
Carried. Carried.
Thank you. So I'll go directly to the first item on the agenda, which is the confirmation of chair and vice chair. The report recommendation is that the Board of Health for the City of Ottawa Health Unit confirm the election of Councillor Keith Aglai as chair for 2021 to be confirmed at the first meeting of each year of its term as required by the Health Protection and Promotion Act, and confirm the election of member Tammy Di Giovanni as vice chair for 2021 to be confirmed at the first meeting of each year for the term as required by the HPPA. Chair Aglai, do you accept?
Sure, why not? In the middle of a pandemic, sure.
Vice Chair Di Giovanni, do you accept?
I accept.
Are the recommendations carried?
Carried.
Okay.
Carried.
Thank you.
Carried.
Chair, you may take over.
Thank you very much. And I know I joked about it, but I do take the role as chair of this board very seriously, and I see it as a real privilege that you place your trust in me to do this, and to our great vice chair. So thank you all for that. We're now going to go through the usual consent agenda process. For those participating or watching from home, who may not be familiar with the process, I will list each item on the agenda, and for any items where board members don't have any questions or concerns and we don't have any public delegations registered to speak, the board may carry or receive these items on consent, which is to say without any discussions. We'll now go through the list. First is my verbal report, so we'll hold that. Then Dr. Etch's verbal report, we'll hold that. Next is lessons learned working with long-term care homes during the COVID-19 pandemic. Anybody have any questions, concerns with regard to that report? Sorry. Would you like to hold that, Member Gower? Yes, we can. Of course. Next is the COVID-19 pandemic response, looking ahead and building back better. We have both public delegations as well as an amending motion being proposed by Member Menard. And I believe that Dr. Etches is also going to give a brief overview of that report as well. So we will hold that. Ottawa Public Health Strategic Plan for 2019-2020 year in review. Can we carry that?
Okay.
Okay, thank you. And then we have the additional item of Ottawa Public Health submission to the Government of Ontario on the 2021 budget consultations. Can we carry that as well?
Okay.
Carry, thank you. So we'll now go back to the first item on the agenda, which is my verbal report. So good evening, everyone. Bonsoir, Kwe. I'd like to welcome everybody to the Board of Health's first regular meeting of 2021. And I'd like to begin tonight's verbal report with some positive news. Earlier today, the Government of Ontario announced a plan to gradually lift some of the current restrictions and to return to a regionally applied color-coded system: green, yellow, orange, red, and gray, with different levels of restriction in each color classification and indicators and thresholds for regions to move from one level to the next. For Ottawa, this means that some of the current restrictions will be lifted as of February the 16th. I know Dr. Etches will have more to say about that as a part of her verbal report in terms of where Ottawa currently sits within the color-coded system, but I wanted to share this news with you and to say that it is a welcome development. And I'd like to take this opportunity to thank the provincial government for moving back to a regional approach to imposing or lifting restrictions in the province. That's greatly appreciated. It was just over a year ago, on January the 27th, 2020, that Ottawa Public Health initiated its incident management system in order to effectively respond to the COVID-19 pandemic. And 2 days later, on January the 29th, Dr. Etches provided her first update to City Council on the situation relating to the novel coronavirus. Since then, the work for OPH has been nonstop, and the impacts in our community have been far-reaching. I want to take this opportunity on the anniversary, for lack of a better term, of the beginning of all this, to thank all of the OPH staff for everything that they've done. They have been dedicated and committed, working really without pause for over the last year. And while we know that vaccines are down the road and we hope there's a light at the end of that tunnel, there's still a lot of work to be done, and the OPH team still continues to do it each and every day, day in and day out. And so I want to take this opportunity to publicly thank them for that, and also to acknowledge I've not talked to a single employee of OPH that, despite all this, does not have a positive upbeat approach to the work that they do every single day. So that takes a definite mindset that we should all have, I think, as we deal with this. So thank you all for your commitment and your hard work. As is noted in the COVID-19 pandemic response lessons learned report that's on tonight's agenda, throughout the pandemic, people's coping strategies have been challenged in significant ways. And as a result, OPH has been working hard with its partners to increase resources and raise awareness in order to better support our community's mental health. Many of those initiatives are listed in the report that's on tonight's agenda, so I won't repeat them now. Rather, I'd like to highlight a few of the more recent initiatives. On January the 19th, 2021, OPH coordinated and presented the Mental Health Expert Tips live session on YouTube with Dr. Raj Batwa, psychiatrist in chief at the Royal, shared tips and strategies to promote mental health and wellness during challenging times, and Linda Cove, a public health nurse with OPH's mental health team, shared community mental health resources available for residents. Board members received an email that on January the 18th, so some of you may have watched the event live, but if you were not able to do so, the video is available on OPH's YouTube channel. I encourage everyone to check it out and feel free to share the video on your social media, on your own social media and with your networks. Ottawa Public Health is working with the Kids Come First health team as well, CHIO and Ottawa Child and Youth Initiative, to organize and present a live event called Youth Mental Health and Addictions Virtual Town Hall. Taking place on February the 11th, 2021 at 7 p.m., this event will give parents and youth the opportunity to question various experts in the area of youth mental health and addictions, including questions on where to get help. The event will also launch a new mental health resource, a Know What to Do guide to help youth, parents, and caregivers start the conversation about mental health, know what to look for, and learn about positive coping strategies, including supports and services. Panelists for the town hall include representatives from OPH, CHIO, Parents Lifeline of Eastern Ontario, YouthNet, Rideau Wood Addictions and Family Services, Centre de Cap, and Valoris. Lastly, OPH has partnered with Kids Come First Health Team, the Ottawa Child and Youth Initiative, and CHIO's YouthNet to launch the second edition of the Your Minute video campaign. The campaign will work with and engage youth ages 14 to 18 across Ottawa and our region to share messages of hope and resiliency with their peers through a 1-minute video. The purpose of the campaign is to provide youth with a platform by which they can inspire others and normalize experiences of the pandemic by sharing stories and coping strategies while fostering hope and resilience. Increase their knowledge on issues related to substance use and mental health, and engage youth to adapt and disseminate mental health and substance use prevention messaging to their peers. The campaign will be launched at the beginning of March, and we are excited to see the talent, creativity, and resilience of Ottawa's youth on display. February is Heart Health Month, rather. Members may be aware that February is Heart Health Month, and again, I'm reminded of the COVID-19 pandemic response lessons learned report that's on tonight's agenda, and the fact that due to the pandemic response, OPH's work on chronic disease and injury prevention has been greatly reduced, as have preventative screening and monitoring of chronic diseases. We also know that behaviors that contribute to the development of chronic diseases, such as insufficient sleep, physical inactivity, and alcohol use, have worsened. In light of that, and given that this is Heart Health Month, I would like to take this opportunity to remind everyone of the importance of eating a healthy and balanced diet, getting enough sleep, and exercising regularly. In addition to being good for your heart, these measures can also boost your mental health and resilience during these challenging times. Also important, pay attention to how you feel when shoveling snow, stay warm, take breaks if you need to, and seek medical care if you feel unwell. Finally, lastly, some of you may have already heard, but I wanted to share the good news and take the opportunity to congratulate our Vice Chair on her recent promotion as CHIO's Chief Nurse and Senior Clinical Vice President. When Tammy attended her first Board of Health meeting in February 2019, I introduced her as the Director of Ambulatory Care and Chief Nursing Chief Nurse Information Officer at CHEO, noting her master's degree in health administration and lifelong volunteerism, and in announcing her promotion to the position of Chief Nurse and Senior Clinical Vice President, Alex Munter, CHEO CEO, noted that Tammy started working at CHEO as the surgical ward nurse in 1995, and that she has earned respect across CHEO and Ottawa in numerous leadership roles. I couldn't agree more. It's a pleasure to work with Tammy as the Vice Chair. Congratulations. CHEO is very lucky to have you, as are we. That concludes my verbal update, and I'd be happy to take any questions. Seeing none, I will then ask Dr. Etches to provide her verbal update. Thank you very much.
Thank you. Good evening, Kwe, Enge, Tanishi, bonsoir.
Sorry.
Oh,
Sorry, Vera, I don't mean to
Yeah.
interrupt. Chair, we do need to receive your report.
yeah.
Point. Good point. Received?
Received.
See, I'm a brand new chair. I just started tonight, so.
Thank you.
All right, back to you, Dr. Etches.
Sure, and I would like to begin by honoring the Algonquin Anishinaabe people on whose unceded traditional territory the city of Ottawa is located and on which we're virtually gathered this evening, and recognize that this land has been a gathering place for many peoples for a long time. And I'd also like to recommend recognition of and participation in Black History Month activities to continue to build our understanding of anti-Black racism and its impact on the health of Ottawa's population. This year's theme for Black History Month is "The Future is Now." So I encourage everyone to learn about city activities and activities across Ottawa that are celebrating the accomplishments of Black Canadians, both past and present. So further in tonight's verbal report, I'll provide updates on COVID-19 vaccination, on COVID-19 testing in school communities, and also on our financial situation. So starting with the rollout of the COVID-19 vaccines, members will recall that on December 14th, definitely ahead of schedule, that was good news, the government of Ontario delivered the first shipment of the Pfizer-BioNTech vaccine to the Ottawa hospital. And the planning, of course, has been going on for some time, and our teams have been preparing the logistics, the distribution, the communication, and the outreach required for a successful implementation of a COVID-19 vaccine program. And we're working in lockstep with the city's Emergency Operations Center, our provincial partners, the local hospitals, again, with the Ottawa Hospital leading in the first clinic that was established. Our common goal is that the vaccine is distributed as efficiently as possible. And also, as you know, the long-term care home and retirement home residents and their caregivers and families have unfortunately been separated too often due to COVID-19 precautions. So it was particularly heartwarming to see that we were able to start, Ottawa Public Health became one of the first health units in Ontario to transport Pfizer vaccine out of the hospital clinic into the Pearly Rideau Veterans Care Center. It was the first long-term care home to vaccinate residents in our city. And so we've used two different models to vaccinate residents. They're either models where the home has administered the vaccine to its residents, their immunizers come from their staff, and then Ottawa Public Health nurses and paramedics and local partners also is another model of going into the homes to help administer the vaccine. We've used the expertise of CHEO pharmacists to prepare and handle the vaccines, and we have administered collectively over 9,000 doses to long-term care homes, retirement homes, and congregate care settings in our city. And as a memo distributed just this past Friday, February 5th, we can celebrate that Ottawa's 28 long-term care homes have received now the second round of offerings of the Pfizer vaccine. Comme indiqué dans une note de service distribuée vendredi dernier, depuis le 5 février, l'ensemble de 28 foyers de soins de longue durée d'Ottawa ont reçu la deuxième offre du vaccin Pfizer. So this COVID-19 vaccination plan is not just about administering the vaccines. There's a lot of preparation, and the success that our team saw at the Pearly Rideau and other long-term care homes started before the distribution of vaccines, with weekly calls beginning in December with long-term care home operators, ensuring they had the latest information, that people would be ready with consent forms to have the vaccine as soon as it was available. the communications teams created a lot of educational material of the Ottawa Public Health Vaccine website, myth versus fact videos, and we're really working to demystify the vaccine and raise awareness about its importance and safety. So this type of collaboration is what's needed to vaccinate the residents of Ottawa. I'm also pleased to note that on Friday we received 4,000 doses of the Moderna vaccine, and this is the first Moderna vaccine in our community. It is being used to vaccinate residents in retirement homes, the highest risk retirement homes in the city. So we're moving quickly, and we're branching out to more partners in the community to ensure that we increase our capacity as we go. And we're building in redundancy and extra immunizer capacity. So we will now have community physicians and the Queensway Carleton Hospital join Ottawa Public Health nurses and paramedics as mobile immunization teams. Allant de l'avant, des médecins locaux et l'hôpital Queensway Carleton se joindront aux infirmières de santé publique Ottawa et aux ambulanciers pour former des équipes mobiles de vaccination. It's a multi-agency response. It's running nonstop, and it's inspired by the smiles that we continue to see from people being protected by the COVID-19 vaccines, like the one from Arnold Roberts, who's a resident of the Pearly Rideau Hospital and the first person administered the vaccine in Ottawa via a mobile immunization team. So people continue to ask, when will their time come and how will they know? So Ottawa Public Health and the City of Ottawa will continue to provide more and more clarity on the sequencing of the rollout of the vaccines and the different access points that will become available to those phase 1 populations as the vaccine supply increases. So we know that the province is continuing to provide guidance, and we apply that provincial framework locally. We know we will have many different points of access that will increase over time, whether they're mobile or fixed sites, neighborhood-based options, the hospital clinics playing an important role in reaching healthcare providers that are at highest risk. So I just encourage people to continue to turn to the Ottawa Public Health website as a credible source of information about all aspects of the pandemic response. And we will use many channels for communication as we are able to offer the vaccine to more people. So with respect to COVID-19 testing in school communities, over the past 2 weekends, and again, in collaboration with CHEO, Ottawa Public Health has hosted COVID-19 rapid testing clinics at local schools. Over the weekends of January 30th and 31st, and then February 6th and 7th, there were mobile testing clinics set up at a host school, and invitations were sent out to all students, staff, and families in the surrounding region. Approximately 10 schools were invited per weekend. Les fins de semaine du 30 et 31 janvier et du 6 et 7 février, des cliniques mobiles de dépistage ont été mises en place dans une école d'accueil et des invitations ont été envoyées à tous les élèves, au personnel et aux familles de la région environnante. Environ 10 écoles ont été invitées chaque fin de semaine. And through these clinics, asymptomatic individuals were offered rapid antigen testing using the PanBio test, and any individuals who received a positive result on the rapid test were called back to return the same day for a confirmatory laboratory-based test. Whereas individuals who were experiencing symptoms of COVID-19 or who had had a recent high-risk exposure to COVID-19, they were tested right away with both the rapid test and the laboratory-based PCR test at the same time. So neighborhoods offered testing were selected using a data-driven approach to look at areas with higher rates of COVID-19, in particular parts of the city. And Ottawa Public Health and CHEO plan to continue to offer similar testing in the upcoming weekends in various neighborhoods around Ottawa. The purpose of these rapid testing clinics is to further reduce the introduction of COVID into schools and to learn more about this COVID-19 transmission risk related to schools. So by identifying asymptomatic or mildly symptomatic individuals before they go to school, we're aiming to reduce the number of individuals who are exposed to COVID-19. And the contact tracing that follows a positive test, it enables us to take steps to further reduce spread. In addition, the testing results provide us with information about the extent of COVID-19 transmission in the community, helps us monitor trends and inform public health measures. The school-based testing is intended to reduce barriers to testing by providing convenient testing in a central school location. Le dépistage en milieu scolaire vise à réduire les obstacles au dépistage en offrant un test commode dans un lieu central à proximité de l'école. So in addition to CHIO staff administering the tests, the sites were staffed by Ottawa Public Health nurses and community developers who provide language and cultural assistance and access to wraparound supports to help individuals and families who might face barriers to testing or isolation as it relates even to food security or housing security, income support, and other assistance. So to conclude, I want to mention with respect to Ottawa Public Health's current financial situation, I'm pleased to confirm the Ministry of Health has advanced $12 million of funding for COVID-19 related expenses based on Ottawa Public Health's year-end projection that was submitted at the end of Q2. Additional expenses were incurred in the latter part of 2020 due to a surge in cases, the reinstatement of some essential core services, migration to the provincial case and contact management system, other factors, including our initial campaign, vaccine campaign related expenses. So Ottawa Public Health will be submitting an additional request to cover extraordinary expenses as part of the fourth quarter standard activity report. It's due to the ministry in mid-February. That submission is still being finalized, but it is anticipated that provincial funding will fully offset the above noted costs and lead to a balanced budget. And as noted in our budget submission report, it was added to tonight's meeting agenda, our expectation is that the province will commit to fund all COVID-19 related expenses, including vaccine related costs, through 2021. And our recommendation is that they sustain the 45 additional school health nurses as part of our base budget going forward. I said I was going to conclude with the finances, but of course we should talk about our understanding that following the provincial lockdown, and the announcements made today that Ottawa would return most likely to an orange status. And that the related restrictions in the provincial framework, that's based on our indicators up to today, the rate of COVID in our community, the percent people testing positive, it means that there will be additional opportunities to come into close contact with others as we go about accessing more services. So I want to really underline for people that we need to take a cautious approach. We need to do that routine use of protective behaviors. We need to use our masks, use distance between each other, still limit our contacts, still be so careful with those social gatherings because we see the impact over the holidays. If there's too many social connections happening, COVID gets an opportunity to be transmitted. Ottawans were able to keep COVID-19 levels manageable in the orange level in the fall. And yet we know there could be even more rigor required if more transmissible variants of concern take root. So at this point, we're thankful for the wastewater monitoring being done by researchers at the University of Ottawa, the CHIO Research Institute, working with the Robert O. Pickard Environmental Center of the city that collects and treats wastewater from 91.6% of Ottawa's population. We will look to that monitoring, and we will have the results from all the positive COVID-19 tests that are now being screened for the variant, and we'll keep an eye on this risk in Ottawa. To date, we've had 6 UK variants and 1 South African variant detected, and all people who were involved in following isolation protocols. So I do want to conclude right there. Cela conclut mon rapport verbal et me fera plaisir de répondre à vos questions.
Thank you, Dr. Etches, very much for that. And I echo your message that even as we make progress, we have to still exercise caution and do all the COVID-wise things that we've been saying now for the last year. So it's a simple message, but we can't lose sight of that. So I'll run through the member list in case anybody has any questions for Dr. Etches arising out of a report. And first off would be Member Tilley.
Thank you, Chair Egli, and congratulations to you and Member De Giovanni for being back as chair and vice chair. And Dr. Etches, to you and your wonderful team for the excellent work you're doing. I don't think it's any secret there's been an outbreak amongst the shelter population, the shelters, and I have to commend you and the team, your entire team, for their excellent work. The daily calls, the guidance, the support has been much appreciated. And in our case too, working with your comms team, certainly Katie Barata and Eric did a great job in helping us to a very, very sensitive time for us as our focus became protecting the population under our roof so that they weren't scrambling and panicking to get outside when it was -20. So thanks to you too for your call and your time. So a great job there. Just sort of, again, a layman's question as we look to the future is the odds of leveling this off through the spring or summer, even with a reduced supply of vaccination compared to what we were hoping to be the supply that was coming, and the chance of bringing these numbers down even without the vaccination as the older populations get vaccinated. That was my first question. And the other one was just as vaccinations do start to enter into the population, do you see then the percentage of those who are asymptomatic increases significantly? And what are the risks or the benefits of that, even where most people gradually, as the vaccinations spread to the more vulnerable populations, I imagine more and more people would be asymptomatic. Is that what you see for the summer and fall months?
Thank you. I will make some comments to address your questions, although I think you hopefully aren't too surprised I don't have definitive answers for you. In terms of the COVID in our community, it's not likely to go away on its own. Unfortunately, you can see it takes this concerted effort of the people in Ottawa to not allow close contact between each other and to support workers, to have protection in their workplaces, to be able to decrease it. And I think that will continue into the summer. I think we'll still need those masks and the distance. The vaccination, I'm hoping we will see some benefits from the protection of those most likely to be hospitalized before the summer. Because we have protected residents of long-term care homes. We're moving on to high-risk retirement homes. We will get to people over 80, higher risk communities, the healthcare workers who are at highest risk. So I think that is encouraging if we can start to see that, because that's been creating the pressure on our hospital system and leading to the concern that we need to be, in lockdown when the rise is too great. We know it's always worth preventing a COVID infection, no matter what age you are, because you can't predict who is going to get a severe infection. You don't know if it's going to be you or not. So it's not like I would recommend we just let COVID go because the people most likely to be hospitalized are protected. No, there still would be risk there. We need to protect everyone we can by preventing infection. And when we think about the population becoming more vaccinated, would there be more asymptomatic infections? That one is hard to answer. What we know about the impact of the vaccine is that it reduces severe illness for the people who are vaccinated. And what we're trying to find out as we learn from vaccination programs around the world is whether that vaccination also prevents ongoing transmission, say if somebody did have an asymptomatic or a milder infection. And there's some signs, I think people are starting to look for that kind of outcome in studies of different vaccines. So we need to find that out. Yes, so for now, I think we are not expecting a big change in the percentage of asymptomatic infections, given the low levels of vaccination right now. And we have to learn more about that.
Thank you.
Thank you, Member Tilley. Member Pinnell, please.
Dr. Etches, as you were saying in your report, you had a chance to be at schools the past 2 weekends. often we read that children are asymptomatic, sorry, but they carry it. I was wondering, by the results you got, did you see any of that? Did you get a lot of asymptomatic children?
I believe I just don't, we know there were 433 people tested.
Yeah.
213 were students. The other 219 were staff or family members or community members. I actually don't know what proportion of those students were symptomatic or not. So I'll have to follow up with you. But 6 of those students tested positive.
Oh.
So it was about, about 2.8%.
Mhm.
And that allowed us to do the contact tracing and make sure that people didn't enter into the schools while they were potentially infectious. So I'm just checking. It seems like across the site there were asymptomatic students who tested positive.
Okay. Thank you. Thanks.
Thank you very much. Member Menard, please.
Thank you very much, Chair, and congratulations to you. Thanks for your leadership once again. And Dr. Etches, thank you for the report. I just have one question, and it's around what Member Tilly had raised around the shelter system. We just received a memo to Council with regard to somebody that's tested positive from the Tom Brown Respite Center. Tested positive for COVID-19. I understand that that person's now in the Coburg Isolation Center. But I'm wondering about recent times in the last week and a half after the initial outbreaks that we were seeing in some of the shelters. So in the last sort of week and a half, have we been seeing cases from the shelter, Salvation Army, Mission, Shepherds of Good Hope? Are we seeing issues and problems there with cases in our shelter system? Do they continue?
So I do believe that as we follow up with high risk contacts of people who tested positive, that there are some people who are testing positive in that pool of high risk contacts. And so we continue to find new positives, but those high risk contacts are isolating. They are isolating, and so that should prevent further ongoing transmission. But for everyone who tests positive, we do that work to find out if they've been in contact with anyone else, so that we can continue to work on that containment. So it is an ongoing process. I think it will take some time. We continue the surveillance testing also. So on top of the high risk contacts where we're asking people to self-isolate and we test and we monitor for symptoms, we're also doing surveillance testing, which is everybody across the shelter system on a repeated basis. And that may well also yield some positives. And so we just continue that process of supporting people who are positive to be isolated, and then following up with their contacts and making sure that people who are high risk contacts also have the ability to isolate. And it's problem solving, different supports needed for different people, but extreme collaboration across the city, public health, housing service providers, Ottawa inner city health, supporting where there's more health needs. And so I do have confidence that it will be brought under control.
Okay, that's helpful to hear. And I'm just hearing rumors that we're seeing some outbreaks at our shelters. And is that the case? We're still seeing that in the last kind of week or so? Okay.
Yeah. I think this will take a bit of time as you work through each incubation period and the follow-up.
Okay, thank you.
I should,
sorry,
sorry, Councillor or Member Menard, I should definitely underline it does not mean that housing is not available. So let me see, housing is available. So for people who still need shelter tonight, next week, the city is still using the usual process, call 311. There's an intake worker will be assigned, and again, work through what that person needs and the options are available.
Okay. Okay. Thank you very much, Dr. Etches. Thank you, Chair.
Thank you. Member Lakin. Member Lakin, can you hear us?
He is on the phone, so he may be having difficulty unmuting his phone.
Remind him how to unmute. Is it *6 or *9?
There he goes. Yes, Member Lakin.
Thank you. Are we good?
Yes.
We can hear you just fine. Yep.
Okay, my apologies. A, that it took me so long, and B, that you now have to listen to me. I have no no questions for Dr. Etches, only a comment and of congratulations to the chair and vice chair, and really to reiterate my CHEO CEO's remarks about the vice chair's appointment and her promotion. She really does have the respect of CHEO, and you are right, Keith. CHEO is lucky to have her, and so is the Board of Health.
Thank you. So we'll move to Member Kavanaugh then. Is that okay, Member Lakin?
Yes, I've completed all of my remarks. Thank you.
Okay. All right. Thank you, Member Kavanaugh.
Thank you very much, and yeah, congrats again to Tammy. Can't say it enough. It's great. Thank you, Dr. Etches, for the report and keeping a smile on your face throughout all this, and keeping upbeat. I really appreciate it, and I think it's needed. There's still lots of concern as we wait for the vaccinations. One of the things that I'm hearing from people is just a little confusion still about vaccinations first, particularly in categories such as parents with children with special needs. That was one of the categories that people were a little confused about in terms of when they get their vaccinations and if they were, put ahead. And my other question is about seniors in social housing. We're talking about retirement homes, but have we looked at with OCH about seniors in social housing? We have seniors only buildings throughout the city. And of course we have a double interest there because they are seniors, not necessarily all over 80, but very, obviously seniors, but also at high risk because they're low income. And so it makes them a little more vulnerable in terms of what they can get in terms of their resources are. So if I could have comments on two things. Thank you.
Yes, so we know that the province is hard at work to try to bring more clarity to some of the populations that have been mentioned as priority populations for phase 2. For example, people with chronic conditions, which chronic conditions, and I think for the parents, it wouldn't be the children that are eligible for vaccination, but for the parents as caregivers of people with chronic conditions. I know that that is something under consideration. So it is, I guess the simple answer right now is it's phase 2 and we'll get more detail. I think something we're learning, is how to best identify people who fall into this category of, whatever list the province comes up with. And I think, we'll be working with healthcare providers, to try to flesh that out. For older adults, we also understand this age-based approach of starting with people over 80 is something that we'd like to start as soon as we can, as soon as vaccine supply allows. And we also want to add in, because people over 80 is still a big population, we want to add in that dimension of the neighborhood risk and start with the neighborhoods as well that are at highest risk. And so it's usually lower income populations with more newcomers where we've measured more risk of COVID. we have a limited supply of vaccine. I think everyone gets that. And so we want to use it to have the biggest impact we can on preventing hospitalizations and deaths. And that means the whole population benefits, right? So if we can prevent hospitalization among older adults, lower income, newcomer communities, then that will help everyone with that health system functioning. And so we are working with partners to identify where are the buildings with higher numbers of seniors at greater risk. We have a community engagement table. We're working with Ottawa Community Housing. Today, last week, I've met with different seniors networks who are incredibly connected to communities that require more support. And so we're getting good feedback on their ideas of how to reach people in different languages. We've got offers of ongoing translation into languages we haven't got to yet. So I'm very encouraged that this is a population that is interested and ready to receive the vaccine when it's available. And we'll be making use of all those communication channels as soon as we get the green light and the vaccine supply. So again, using the community engagement table, networks that exist, certainly focused on what you're raising.
And thank you very much. And thanks to Dr. Malaki, who came out and spoke to my community. And of course, that was the major part of the questions, was different chronic illnesses. And but I wanted to speak for those who don't come out to meetings, and that's the very vulnerable seniors that don't tend to come out as much, but they're definitely, we know they're in need. And I do hear from them. So thank you very much.
Thank you. Member Gower.
Thank you, Chair. I wanted to ask about rapid testing. I was very interested to hear about the initiative with rapid testing in schools over the past 2 weekends. I've also heard from the province that there's rapid testing being deployed at long-term care homes as well as high-risk workplaces. And I was curious about what Ottawa Public Health, or in general local public health's involvement is in terms of administering rapid tests at long-term care homes or other workplaces in Ottawa.
So yes, we're following the guidance around shifting to more rapid test use in long-term care homes. We aren't directly involved in providing the test, but we would be involved in helping interpret the results and following up on any positives. I will just pause and see if anyone from the team would like to add anything more from our long-term care outbreak team, or from our testing teams. Anyone want to comment more on the rapid testing in long-term care homes? And in terms of workplaces, similarly, we are here to support when someone tests positive. So we would work with workplaces to interpret the results. Right now, if someone tests positive on a rapid test, our recommendation is that they have a confirmatory testing with the PCR test. And so really we have a minimal role in the implementation, that the training, all of that deployment is done through the ministry. We get involved after there's a positive.
Okay, thank you.
Thank you, Member Gower. Member El-Shantiri.
Thank you, Mr. Chair. And Dr. Atchis, we see we're coming along with testing the wastewater. Is that something we'll be using in the future, even after this pandemic too? Because it seems we came a long way with the result of that testing, the gray water.
I think so. We need to evaluate it, which the researchers are starting to write up their results, but it does, to my mind, it has made a difference in being able to communicate what's happening in our community. And if the virus is going to stay with us, it makes sense to stay with the monitoring, I think. So we'll certainly be learning from that, and I could see its value continuing for a while.
Now, it was some discussion about testing in different area to have a better understanding from a different part of the city. Is that still something they're looking to achieve, or?
My understanding is there's a little bit of sort of pilot work underway to see if it could be useful in a long-term care home or certain smaller sections, yes, of the city. The work I referred to also tonight was that it's a new tool we're going to see about using to detect the variants of concern as well, but that's at the whole city level. And again, it's not quite clear yet what the threshold is. How many cases of the variant of concern would we need to have here to be able to detect it? It could be a higher number, but that's something, again, we'll follow and we'll learn from that monitoring.
Okay, thank you. Thank you, Mr. Chair.
Thank you. Vice Chair, please.
Thank you, Chair, and thanks to the members for your kind words. I really appreciate it. Dr. Etches, my question, I know we can't predict the vaccine supply, and we're all hoping for more supply sooner rather than later. But if we were to be flooded with supply, what's the ability of OPH to ramp up quite quickly to get vaccines in arms if we do get an unexpected good wealth of supply?
So the strategy involves, and again, it's not just OPH, it's city, it's hospitals, it's lots of people involved, but it involves the fastest way to stand up greater access is through these mass immunization clinics where we have 4 sites. Floor plans are ready, the supplies are ready. We can stand those up within 72 hours. And they can collectively with those sites, actually up to 7 sites, but the first 4 is where we would go first, along with the mobile teams. They can do 10,000 plus doses of vaccine being given a day, and that's with a 12 or 14-hour day. We can grow that with a 24-hour day, and we would be able to stand those up with Ottawa Public Health and city immunizers, adding in community physicians who have indicated they are interested, as well as nurse practitioners, other primary care providers. We have pharmacists that have said they're interested. And so that 10,000 a day is a baseline where we could grow from there even further. And it doesn't include getting vaccine out to the public through pharmacies or through primary care providers. And those 2 channels are usually our biggest channels, the largest number of points of access across our city in neighborhoods for flu. And so we are wanting to move to that direction as soon as the vaccine supply allows as well. So we're starting with the training of primary care providers and looking at building their use of the databases, for example, that the province is requiring through these mobile clinics that we're offering, then would partner in the big mass immunization clinics and then build that capacity out for primary care also to be then adding in the points of access. So again, would invite the team if they want to add anything more in terms of how quickly we can scale up. But I think that you can see, usually we would get 72 hours notice of a shipment of vaccine coming, so we would be able to open by the time the vaccine arrived.
That's great. Thanks so much.
Thank you. And if I can just add, I think that the plan that's been worked out in the city between OPH and the work of Tony DeMonte is very robust. If the supply is there, if we can open that pipeline, I'm confident that we can get those vaccinations out to a much larger number of people than currently. So I think we're in good hands in that sense. We just need product to get us there.
Sorry, maybe I would love to just add a little bit to my answer, just to say that we are also working with other providers who would run their own clinics. So for example, Wabano and Akausavik, 2 Indigenous health service providers, would be leading their own clinics to also protect populations at higher risk. And so it would be, we anticipate to grow the points of access all at once concurrently as the supply allows. So more mobile clinics, more mass immunization sites, more sites in partnership, led by primary care leads. So I think that collectively it would add up, as well as the hospital sites continuing. So the Ottawa Hospital is an important access point for healthcare workers. And so also continuing to use that capacity as well.
Member Kluche.
Merci beaucoup, Monsieur le Président, and congratulations, Vice Chair Di Giovanni, and you too also, of course, Chair Eglai, for your continued leadership and of the board, and of course, Dr. Etches and your entire team. And thank you for my question, for the work this weekend. One of the areas was in the south end of Alta Vista at schools. I don't know if I can mention them, I won't. But I appreciate it very much, and I appreciate the heads up on that that we received last week for the testing. It's also very exciting that the residents and the staff of the Pearly have had their vaccines. That too is in my ward, and I was in touch with that cause, and it was exciting times at the Pearly to get the vaccines. Councillor El Shantiri asked a bit of a question that I wanted with respect to the variant and the research in the wastewater. Thank you for that. Just wanted to ask you, Dr. Etches, with respect to the variant, it transmits more easily. Noted. Does it transmit more easily only in a non-protected environment? My question is, are guidelines with respect to wearing masks and physical distancing, are those guidelines still as effective with respect to reducing the risk of transmitting COVID in all its forms?
Yes. If people are wearing masks and eye protection, if they're close to others, and if they are keeping the 2 meters distance, that will prevent COVID transmission. Unless there's like an extended exposure, right? People sharing the same airspace for a number of hours, then we start to get into different variables of risk. Is someone a higher risk contact? Some of these other duration of exposure can come into it. But COVID virus, it is not able to be passed on to people who are not in close contact without sorry, maybe I said that too many no's. If people are wearing masks and they're keeping their 2 meters distance, that should protect against variants as well. It's just that we have to pay more attention to our blind spots. There's just a little less room for, being more relaxed around family and friends, and those places where we don't wear masks. It just means that if COVID's there, it's passed on a little bit more easily, is what it seems to be showing us.
Thank you very much. And with that, 1 year into the pandemic, and a little bit of fatigue, a little bit, spring will come, the emergence of the variants, the hope of the vaccine. Is there any change in the messaging, not the substance of the messaging with respect to guidelines and the protective messages, the protective measures, I apologize, but any ideas in your communication staff with respect to refreshing the messaging or to enhance the messaging for our residents?
Thank you. We're always open to ideas. So we have continued our engagement with the community around messaging related to vaccines. So there's an engagement exercise on right now to try to learn what people need in terms of messaging related to vaccines. And so we are linking our prevention messages a bit to the idea that we will get there, but we need to stay steady as she goes. We need to use the routine behaviors that are protecting us, that do bring COVID down in our communities. that's the message right now in terms of steady as she goes. But we're always open to changing and finding ways to resonate. I think we've also really added in more tailored communications to different communities in different languages. I think this is something that we just hope to continue strengthening with guidance from the communities. And community developers that have joined our team are coming up with new ideas that are more culturally appropriate and resonate. And so that, I would say, is also a major focus and area of growth in our communications right now.
Thank you very much. Yes, you have an outstanding communication staff, and I appreciate their culturally sensitive and culturally varied messaging that they use in various communities. So thank you very much. Just one more quick question. You reassured us with respect to additional expenses, but that the provincial government is expected to make us whole. When can we get an update or a confirmation on that? What will be the next reporting to the board with respect to finance and with respect to finance?
So I believe the formal report to the board is our Q4 report, which comes in April. But I will certainly update you through our information meetings. I believe that's our next meeting is in a month. Can share that then, or as we finalize the submission to the ministry, we can also share that confirmed final numbers with you.
Merci, Dr. Etches. That's all, Chair. Thank you.
Thank you. Last but not least, Member Banham.
Hi. So first I want to congratulate both the chair and the vice chair on your reappointment, and vice chair to her promotion. That's amazing. It's so great. And I'm looking forward to working with you. And I want to again thank all of our frontline workers and all the staff at OPH for everything that you do and continue to do. It makes an impact in the community. And we are so lucky to have such a force of nature in the staff and also our leadership under Vera Etches. So I'm so thankful for all the work everyone's doing, specifically the communication staff. I hear nothing but praise. My partner was in stitches yesterday about poor Bruce, the communication staffer, and his Super Bowl post. It was a wonderful post, and it really brought some levity to the community. So thank you. I have a couple of questions that relate to each other. And I had agreed on behalf of some ICU nurses to ask a question. And this is about priority, which we've asked a few of tonight, but there are some ICU nurses that are constantly exposed to the COVID-19 in their roles as ICU nurses. And very few of them have been, according to them recently, very few of them have received the COVID-19 vaccine. They know they're part of phase 1, but they are continually facing exposure and also bringing that exposure home. So I was asked if I would ask that question, but it became even more personal for me because my grandmother passed away 2 days ago after contracting COVID in hospital in Wales, so not in Ottawa, but it just feels that in order to honor my grandmother, I need to ask that question. And, you know, if other contraction of the virus can be stopped by making sure our hospital workers are protected, I feel like that'll be in a service. So I'm hoping you could speak to that, please. Thank you.
Yes, Member Banham, I'm very sorry for your family's loss too, and so difficult when you can't be close to someone as well and grieve together. Lots of sadness like that. And so yes, intensive care unit nurses that are working with people who test positive for COVID are in that group of healthcare workers that are the highest priority to be vaccinated. And that group of healthcare workers being vaccinated started, you know, it was started, the people at the hospital clinics were offering vaccine first to long-term care home workers, essential caregivers, and then a little bit beyond, as capacity allowed to those highest risk hospital workers. But it was stopped in order to make use of that opportunity that then we could move Pfizer out to long-term care homes. And so I know it's sort of unfinished business that we have now done the 2 doses in long-term care. The province has said we next need to go through the 35 high-risk retirement homes. And really just want to recognize the teams continues to adapt, more vaccine, less vaccine, and they're doing it. So today they adapted again with confirmation we could use all the Moderna we received to get the first doses done in high-risk retirement homes by February 10th. So that will be completed. Then it's a matter of how much Pfizer vaccine are we getting. That has to go to the second doses for those healthcare workers and long-term care home workers and essential caregivers that were vaccinated with the first dose of Pfizer. And they've been waiting a bit longer, more like 35 days for that second dose. I believe the Pfizer vaccine that we're receiving this week will go completely to those second doses. So again, no opportunity for that first dose yet to those ICU nurses, but it's coming. So we do expect more vaccine towards the end of the month. We will restart the healthcare workers that are at highest risk through the Ottawa Hospital Clinic, and at the same time as trying to protect these other priority populations. So again, we're looking for provincial guidance, but we think that there will probably be more of a concurrent approach to look at all those priority populations together.
Wonderful, thank you. So the second part of that kind of goes along with that question, but also a bit to the long-term care home lessons learned. From reading the vaccination information that we were sent, I understand that for the general public, vaccination is not mandatory, and that's not something public health can necessarily mandate at this point. However, in terms of guidelines for staff in health institutions or whatnot, is there some sort of, whether it be provincial or federal or local, information on whether it be long-term care homes or other community organizations or hospitals, whether they can mandate their staff to be vaccinated? And are those discussions happening? Is that something on the table? I couldn't find much information, and I was looking to see if maybe that is something on the radar.
So Ottawa Public Health is not part of any conversations about making vaccines, COVID-19 vaccines, mandatory. What we are encouraged by is that when we do polling of the population of Ottawa, over 80% of people say that they are looking forward to getting the vaccine and will access the vaccine once it's available, with 98% of older adults saying that. And so, in that kind of environment where there's good interest and uptake, I think that it starts to build momentum and demonstrates, the normality and the, that people talk about the benefits, they'll see the benefits of vaccination. So we don't need to go through a mandatory process in our approach. I can't really speak to what different workplaces are considering.
Thank you. And then finally, on vaccines again, there was some confusion about whether women or people who are breastfeeding or chest feeding could receive the vaccine. There was a change in the recommendations regarding that. And because of that change, I've seen a lot of vaccine hesitancy amongst this community. And I'm wondering if Ottawa Public Health has a specific strategy to address that, or essentially if there's a strategy about that, or if there's any clear messaging that can go out.
Okay, yes, so I think initially people who breastfeed or chest feed were mentioned as not studied and so not recommended. And then there was a move to say, well, there could be benefits and it's worth a discussion with your healthcare provider. And so I'll take a look with the team at what's on our website, how to clarify for people the idea that this is a decision that is permissible and possible, and that's something people can walk through. So yeah.
Thank you. And then perhaps on that same vein, there might be a space for providing healthcare providers with some information on that space, because it does seem that most vaccines have a recommendation that if it's not studied on a certain population, that perhaps they should be excluded. However, that doesn't necessarily mean that they are excluded because of the scientific evidence. And so having kind of some guidelines on how to have that discussion would probably be very helpful. Thanks.
Sure. And I think, as I say, I know the team has had this in mind, so I believe they have communicated with primary care providers. That I think what you're talking about is a bit more of a tool to facilitate the conversation, like a conversation guide. And so I will take that back to the team.
Thank you. Seeing no more questions, can we vote to receive the medical officer's report?
Received.
Thank you. The next item that was held, I believe was by member Gower, was item number 4, which is lessons learned working with long-term care homes during the COVID-19 pandemic. So we'll turn it over to you, member Gower.
Thank you, Chair. There were 2 questions in regards to the notes in the report about mental health with older adults in long-term care homes. One was the report mentioned the rapid decline in mental health and how collaboration was being done with partners on finding solutions and recommendations. I was wondering if anyone from Ottawa Public Health could elaborate a bit on those solutions and recommendations that are being encouraged for long-term care homes.
Yes, I'm going to ask Dominic Bremner to be brought into the conversation, if that's possible, please. Deanne, there she is. So Dominic is the manager who's been leading work related to outbreak management, infection prevention and control, especially with a focus on long-term care homes as well as other settings. And I did want to give her the opportunity to speak to the situation and some of the findings. Certainly a big piece about addressing the mental health challenges was getting essential caregivers back into the workplace and making sure that people had that access to 1 or 2 essential caregivers. And that required working through infection prevention and control approaches. And so Dominique, please, anything you'd like to say that arises out of our experience and the work done, working with partners on this issue of mental health or anything else.
Great, thank you, Vera, and good evening, board members. Vera kind of hit on it. We are looking, what we've been seeing throughout the pandemic is around, when we go into outbreak, and an outbreak management is one positive case. So what part of those IPAC strategies are around isolating, cohorting staff and residents. And what we are seeing is we are seeing a little bit of a decline in the residents. They're not able to get out. They're not able to, socialize. They weren't early on able to even visit family. So to Vera's point around the essential caregivers, it's some work we're doing with a lot of our partners. And some of those partners include Briere. And it's looking at kind of taking that essential caregiver role and kind of stepping it up and, giving them a little bit more access and ongoing training around personal protective equipment and infection prevention and control, so that they're also supporting the staff. That's one thing we did see as well as critical staffing shortages. And this is looked at as like an ethical approach to outbreak management and providing more supports, whether that's to the residents, whether it's staff, in trying to take on some of those roles.
Okay. The other question I had from the report was just around, I think it's staff's confidence in the facility's leadership to manage outbreaks was a factor in overall health of the residents. And I was curious what that meant, how their confidence in leadership, how that affects the health outcomes in the long-term care homes.
Me? Okay. Hi, thank you for that question. One thing we did observe was we did start seeing that either leadership were starting to test positive or were off site sometimes. And there wasn't always the on-site leadership and a little bit of that oversight 24/7. So messaging quickly on was important, and ensuring they had the infection prevention and control support as well as the leadership support 24/7 to help them through, you know, either observing that, you know, PPE, you know, as we've heard, staff are getting tired, just the reminder to ensure they're appropriately hand hygiene. The audits are happening overnight, right? That's not just from, you know, 8 to 5 o'clock in the evening. So that was part of what we were seeing, and just ensuring that the messaging from the facility was being kind of communicated through all levels. So if we were messaging something to the facility, it was reaching the staff. So I think that was part of it, but it was quite, it's a collaborative approach that we really strengthened as the pandemic progressed.
And in terms of mental health and long-term care homes, what kind of access to professional psychologists or professional counseling services would long-term care home residents typically have? Is that resources that are on site or by request or that are doing regular visits? How does that work typically?
That's not my area of expertise, sorry. Yeah, we don't, I probably couldn't answer that across the board. It probably varies from place to place. Yeah.
It is something of interest. I know as a counselor, I hear a lot actually from long-term care home residents and their caregivers and their families, and a lot of concern about the isolation and the mental health. So it's something that I do think we need to keep a close eye on and make sure we're providing the right resources for. So thanks for your information.
I mean, it's part of the level of clinical care that's available, I think is one of the additional conversations that's happening as there are reviews around clinical care and standards and levels in homes. So I think others are looking at that question more so. I did want to pick up on what Dominic Bremner said around the learning that has happened in collaboration with partners and the ministry and Ontario Health, and you know, that we have seen a significant improvement in the mortality and the morbidity, the number of people testing positive when a staff person tests positive, and just that importance of the link with the external environment in the community. The rates in long-term care homes are so directly linked to what's happening in the broader community. So maybe just to highlight our report, but also how we all need to keep doing our part, that when we decrease COVID in the community, that protects long-term care home residents too.
Thank you, Member Gower. I'm just, since we did hold it, I'm just going to quickly go through the list in case anybody had any other questions before we call the vote. So first up would be Member Banham.
Apologies.
No
I
problem.
have no questions.
Okay, thank you. Member Cloutier.
Thank you, Chair. No.
Okay, Vice Chair.
No questions for me, thank you.
Member El Shantiri.
No question. Thank you, Mr. Chair.
Thank you. Member Kavanaugh.
Thank you. It's more of a comment on, I really appreciate the fact that you're talking about the economic conditions and employment conditions for long-term care and the spillover. Have we looked at the connection between home care as well as the long-term care? Because sometimes it's the same workers and the concerns there. Because I hear from people who are getting home care and they're feeling vulnerable because those very workers may be the same ones that work in long-term care as well. We've had, home care is, people are isolated, but the workers aren't. And so I just want to get some comments on that. Thanks.
We do see some temporary and casual workers moving between home care and long-term care, though the ministry has indicated that as much as possible to restrict employment to one workplace to decrease that risk.
I appreciate that. Of course, the reason they're doing it is because they're not getting paid very much and they need the income. So, and I appreciate that this report addresses that concern. And I know that that's something that people who are receiving care note and are concerned about. Thank you.
Thank you. Member Lakin.
No questions. Thank you, Mr. Chair.
Thank you. Member Menard.
Thanks very much, Chair. Just very briefly, it's a question from another city councillor that wanted me to raise it from Councillor Fleury. And he was wondering on the long-term care report, lessons learned report on long-term care, excuse me, what the OPH perspective is on keeping seniors in their home longer as a mitigation measure for what we've been seeing in long-term care homes. Is there a comment on that?
Ottawa Public Health is always interested in prevention of illness and disability and injury, and so promoting wellness, keeping people active, all of these things are helpful. Our population is aging, and there are limits on the supports that can be available in the home. But I do think, again, these are some of the health system conversations that need to happen in terms of how do we best support older adults. And I think, our home care partners have probably more precise ideas about the additional supports that could be provided to keep people in their homes longer.
Okay, thanks very much, Dr. Etches. Thanks.
Member Pinnell.
No questions, thank you.
Thank you. And finally, Member Tilley.
No questions, thank you.
Okay, thank you. Can we vote to carry the report, please?
Carried.
Carried.
Thank you. We're about to enter into item number 5, which has a number of moving parts to it, so to speak. Dr. Etches is going to give some introductory remarks to the report. Then we're going to ask Member Menard has a motion that he wishes to introduce. And then we had 7 delegations. One, for technical reasons, can't participate anymore, but has sent a submission in. And then we have 6 other delegations to speak to the report. And then, of course, members are entitled to ask questions of the delegations or of staff. So I'm going to suggest it's 6:25. I think in all likelihood we are going to go beyond our normal 7 o'clock cutoff time. So rather than interrupt the flow of the item, I'm wondering if Member Banham could move that motion now for us.
Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant of Section 8(1)(c) of the procedural bylaw.
Carried. Okay, thank you. So Dr. Etches, I'm going to ask you to introduce the report, if you will, and then we'll move to Member Menard after that. Thank you.
Certainly. This report is before you. I'm very conscious of, in a time where the whole team is continuing to respond across so many different areas of work. So the communications work's been mentioned, case and contact management, the outbreak management, support to schools, our essential services, standing up as much as we can, our epidemiologists, the surveillance, the community engagement work. There's so many are still responding to the pandemic and trying to prevent further transmission. But people took the time across the organization to think about how can we continue to improve the response. And this report does focus on some recommendations to the province because our partnership with the province has been so essential all along, both partnership with public servants in the provincial system as well as with our elected officials. I need to recognize that our local MPPs have been incredibly available and responsive and part of the communications network to keep people informed. Their input about what their constituents are seeing and the questions that they raise has really informed our response. So the point about putting these recommendations together is, that these are ideas arising out of our experience to date, things that fit with our strategy. I think as a Board of Health, you can see some links to the Ottawa Public Health strategy that you have given us direction on, because we do see that the pandemic has highlighted that there are things we can do to improve our public health and our healthcare and our social support systems. And so, some of these are higher level recommendations related to 4 main areas where we see the economy and health so closely linked. Long-term care, as we have just discussed, keeping in mind that chronic disease and injury prevention are essential public health areas of work, and there's catch up to do, and there's harms that have occurred in that area that we need to address going forward. Mental health and substance use, again, often discussed as a priority here. And we also identified 4 themes where we can use different approaches. We've used them through the pandemic. We can grow them, the use of technology, partnerships, communications, and keeping an eye on our own sustainability of our public health workforce. So this report definitely, it's a check-in. It's a chance to provide the public with more information about the work that we've accomplished during the pandemic response, the challenges we've encountered, the lessons learned, and some recommendations for strengthening our systems.
Thank you very much, Dr. Etches, for that introduction. I'm now going to ask Member Menard, could you introduce your motion so the delegates are aware of it, and members can keep it in mind when they're hearing from the delegates and when they're formulating any questions they might have?
Yes, I will. Thanks, Chair. So the motion is related to paid sick leave and has been distributed to members. Whereas at its meeting of February 8th, 2021, the Board of Health for the City of Ottawa Health Unit is considering 2 reports from Ottawa's Medical Officer of Health on the subject of lessons learned to date from the COVID-19 pandemic. I won't go into their titles. Whereas both reports underline the importance of staying home when sick in order to prevent the transmission of infectious illnesses like COVID-19, particularly as it pertains to workers' ability to stay home when sick without fear of lost wages. And whereas the report titled COVID-19 Pandemic Response, Looking Ahead and Building Back Better makes both health and economic arguments in support of paid sick leave for Ontario's workforce, noting that the COVID-19 pandemic has underlined that a healthy population and a healthy economy go hand in hand, and that differences in earning power and job security directly impact individual, family, and community health, and that some of Ottawa's essential workers are precariously employed, limiting their ability to stay home when ill. And employees attending work while sick can have a ripple effect on the workplace, including transmitting infectious diseases, increasing their risk of injury, and decreasing productivity, which can ultimately lead to increased costs to employers. And whereas, in addition to the economic benefits of paid sick leave to ensure workers stay home when sick to prevent the transmission of infectious illness, a COVID-19 outbreak in a workplace can also result in reputational harm and stigma. And whereas on January 15th, 2021, Ontario's big city mayors put out a news release stating that too many workers across Ontario are having to choose between going to work sick or losing income, and urging that the provincial and federal governments implement a broader sick day program now that provides greater benefits and can be accessed by employees as quickly as possible. And whereas although the federal government has introduced a form of sick leave benefit, it has proven to be insufficient given that it is limited in terms of maximum weekly amount payable to workers. It's based on full weeks of missed work rather than days of missed work, leaving workers ineligible if they miss less than a full week. And it requires workers to apply for the benefit, resulting in a wait for payment and a risk of their application being denied. And whereas workers should be able to miss work when they are sick, regardless of the percentage of days missed in a particular week, without needing their illness to be confined to 2 weeks within a calendar year, and without seeing a reduction in their income for time missed due to illness. And whereas, with the exception of a relatively small number of federally regulated industries, the majority of workplaces are provincially regulated, making it foremost the jurisdiction of provinces to ensure seamless access to paid sick leave for workers. And whereas during a press briefing on January 12, 2021, both the University of Toronto's Dr. Alistine Brown and Dr. Barbara Yaffe, Ontario's Associate Medical Officer of Health, indicated that a pandemic response that relies solely on restricting individual movements and provides no increased social supports will not work. And whereas during that same briefing, Dr. Yaffe also noted that for some, the lack of paid sick days is a barrier to reducing transmission of the novel coronavirus. And whereas during January 11th press conference, Toronto's Medical Officer of Health also talked about the importance of paid sick leave provisions to protect the health of individual workers, workplaces, and the broader community. And whereas at its January 18th, Toronto Board of Health approved recommendations calling on the government of Ontario to require employees in Ontario to provide no less than 5 paid sick days annually to workers after 3 months of employment through amendments to the Employment Standards Acts or through different mechanism, and B, provide necessary funding, fiscal relief, and or support to employers so that all workers in Ontario have access to no less than 10 paid sick days annually in the event of a declared infectious disease emergency, such as the COVID-19 pandemic. And whereas despite these and other calls from public health experts and officials, the government of Ontario has yet to announce measures that include paid sick days. And whereas reports from Ottawa's Medical Officer of Health clearly outlined the need for paid sick leave, which should be reflected in the Ottawa Board of Health's recommendation to the province. Therefore, be it resolved that the Ottawa Board of Health join the Toronto Board of Health in requesting that the province require employers in Ontario to provide no less than 5 paid sick days annually to workers after 3 months of employment through amendments to the Employment Standards Act 2000 or through a different mechanism, and B, provide necessary funding, fiscal relief, and or supports to employers so that all workers in Ontario have access to no less than 10 paid sick days annually in the event of a declared infectious disease emergency, such as the COVID-19 pandemic. Be it further resolved that the Chair of the Board of Health include these specific recommendations in his letter to the Premier of Ontario, further to recommendation 3 of the report titled COVID-19 Pandemic Response, Looking Ahead and Building Back Better. And I just wanted to thank OPH staff for helping to work with us on the motion, and for your conversations as well, Chair Aglai, on this, and for my own staff internally in my office for their help in crafting this. And so I look forward to the conversation.
Thank you, Member Menard. And our first delegate I see is on the screen already, Michelle Arruda, I hope I said that right, from Unifor. And if you haven't appeared before in front of our board, you have 5 minutes in which to present, and then some members may have questions for you following that. So welcome, and I'll turn the floor over to you.
Thank you. Good evening, Chair and members of the board. And as well, congratulations to the Chair and the Vice Chair on your election. I want to thank you for the opportunity to offer this deputation. My name is Michelle Arruda. I serve as the Ottawa Area Director for Unifor, Canada's largest union in the private sector. Unifor represents approximately 315,000 workers across the country and nearly 6,000 in the Ottawa region. These include those on the front line of this pandemic, supermarkets, pharmacies, long-term care homes, along with taxi drivers and telecom workers, and as well as factories and many others. I'm here today on behalf of Unifor National President Jerry Dias and our Ontario Regional Director Noreen Risby to support the recommendation provided in the Medical Officer of Health report dated January 28th. And specifically her recommendation to provide workers the opportunity to stay home when sick. As board members know, paid sick days is a long-standing demand of workers across the province. After extensive consultation in 2018, the Ontario government introduced legislation mandating that all employers provide a minimum of 2 days of paid leave for workers. Unfortunately, these changes were short-lived, despite being very well received by thousands of our members, especially those in low-wage and precarious jobs. Take supermarkets, for example. Despite being heavily unionized sector, collective agreements are not immune from broader economic pressures. Today, 80% of supermarket workers work part-time, most with no guaranteed hours of work, no set schedules, most at or near minimum wage, like most of the retail sector. and no paid sick days. But a generation ago, simply a generation ago, 80% of these folks were full-time, enjoying stable schedules, strong benefit packages. Despite extensive efforts, it has proven extremely hard to negotiate paid sick days for part-time supermarket workers. Employers will often say there's these added costs, which puts them at a disadvantage with the competition. You know, why should Metro do this when Sobeys doesn't? Yet many of these very same employers actively lobby against legislative efforts that would create a common standard and level the playing field. For too long, these employers have had it both ways. I'm happy to say that nearly 400 Unifor members at Ottawa area Rexall pharmacies do have bargain sick pay, but they are the exception and not the norm. The transition away from stable jobs is happening everywhere. Today, nearly half of all workers who have taken on a part-time job, they do this involuntarily. In the GTA in Hamilton, barely half of the workers are in stable employment. The rest are in some form of precarious work, specifically women and workers of color. And the situation we face today is unlike anything that we could have imagined back in 2018. The same workers who were stripped of those paid sick days are now the ones on the front line, the essential workers who cannot afford to lose 1 day's pay, because unfortunately having little or no paid sick leave can be a detriment for reporting and self-isolating for workers everywhere. This is very important during a pandemic, as the medical officer of health noted in her report, for reducing spread between coworkers, families, and the public. Unifor is tracking nearly 300 active COVID cases with our members in Ontario, many of them in high impact sectors like healthcare. What we've learned is that it takes a collective effort to combat the virus, and it requires us having the right policy tools for the job. Paid sick days is one of those tools. Telling workers it's okay to stay home if they're sick is simply the right thing to do. We support Dr. Etch's call for government and employers to take action. We are actively demanding the province introduces 7 permanent paid sick days, adding another 14 in a public health emergency. Momentum is building and the city politicians on this matter, and that's a good thing. Last week, Toronto stepped up. Today, we asked Ottawa to step up, and that starts with a favorable vote today. Thank you for your time, and I look forward to any questions.
Thank you very much, and you're just in under the 5 minutes. So I'm going to ask members, rather than going through the list each time, if you could use the hand raised function on the Zoom call. And for Member Lakin, if you could just send me a quick email or to the clerk to let her know if you wish to ask any questions. So I'll just check if anybody has. We have Councillor Kavanagh has raised her hand. So Councillor Kavanagh.
Thank you very much, Michelle, for coming out today and presenting. I don't think people realize out there when they're shopping that the workers that they may be dealing with at their supermarket, it's probably the only people they see actually these days, could be tired and run down and on the verge of getting sick because of it. Can you tell us which supermarkets do have the sick days? I just want to make sure I shop there.
So I do not have all that information, but I most definitely can get it. It's an actually great question. Rexall most definitely has paid sick days currently right now. That's who Unifor services. I can definitely get you that information and send it through. They do, yes.
Okay, not Shoppers Drug Mart?
We don't service Shoppers.
Okay, all right.
Yeah, it's not
well,
part of my
it's good to know because I think people need to know that this is because they're always saying thank you to the essential workers, and I think that's the concern I have is that thank you's nice, but maybe there's something we can do for them in terms of some action. Anyway, I know my colleagues will have some questions. Thank you.
Actually, I don't see any other questions for this particular delegation. So I want to thank you, Michelle, for coming out tonight. and sharing your perspective. And next on our list is Sam Hirsch. And Sam, as I said earlier, delegation is 5 minutes. And so off you go. And look forward to hearing from you.
Thanks. And thank you, Chair. And that was a good question. Just start, Councillor Kavanagh. I would also like to have that list and know where to shop as well. But, my name is Sam Hirsch, and I first want to recognize that this meeting is taking place today on the unceded and unsurrendered territory of the Algonquin people. And, this is important, I think, to recognize, especially in the context of Councillor Menard's motion, because, many of those of Indigenous descent throughout our city and our province are among those most likely to hold precarious jobs that have a very low likelihood of having access to paid days. I'm speaking today on behalf of Horizon Ottawa, an organization that some of you on this board may know. C'est une organisation qui lutte pour une ville où tout le monde peut s'épanouir et pour un conseil municipal qui n'ait pas peur de prendre des positions courageuses comme se déclarer son soutien en faveur des congés de maladie payés. When this motion came to many of you via council in October, it was voted down by some of you here, in particular two members of this board, Councillor Cloutier and yourself, Councillor El-Shantier, and I'm hoping that you will, and I'm hopeful that you'll, both change your minds today. The argument that was brought up in particular with the mayor was that this is outside of your jurisdiction. And this is a common argument that we hear from many on the city council, that we can't support certain initiatives because they're outside of our jurisdiction. They're not in our wheelhouse, or as the mayor quoted former Ottawa area MP Royal Gallipo, that we need to stick to our knitting. But what this is really saying is that, to a certain extent, you lack the political will and imagination to take our courage to have a position on an issue that is hard or difficult. Although issues like paid sick days or any issue to do with health have physical or personal boundaries, the effects of their actions cross these physical boundaries and these physical borders. Nothing's stopping you from using your influence as a city councillor to shift or influence an issue, regardless of their jurisdiction. To me and many other residents in the city of Ottawa who may be or may have been in need of paid sick days due to precarious, dangerous, or low-paying work, the jurisdictional argument is just a poor excuse for lacking, quite frankly, the political courage to stand up for residents. Many issues that affect municipalities are inside provincial jurisdiction, but this does not mean you can't or should not take a stance on that issue. They have real impacts on real people. When one of your residents can't pay their rent because they lost their job as a frontline worker because they needed a day off, then that'll be in your jurisdiction. If one of your residents contracts COVID and needs to access a local clinic, then that will be in your jurisdiction to help them find that. Paid sick days will clearly be a deterrent to these things, and they affect residents in your wards, in your jurisdictions, so to speak. Really, there's not much more that I can say in support of paid sick days that mayors in other cities, medical experts, and other city officials around the world, frankly, have already said. This issue, as mentioned earlier, disproportionately affects low-income people, women, Indigenous folks, as mentioned earlier, and communities of color who are all more likely to have precarious jobs. In a pandemic, we all benefit when sick workers can afford to stay at home, especially service workers who are less likely to be covered by existing programs. This was the primary purpose of the CERB, providing financial support, which enabled some workers to safely stay home instead of seeking work during stay-at-home orders. It's the same concept with paid sick days. If you support frontline workers, like you've all claimed to, and you are serious about keeping this pandemic at bay, you'll vote in favor of this report and not make the same mistake as some of you made the last time and oppose such a straightforward and simple recommendation. And I hope you can encourage some of your other council colleagues outside of this board to do the same. Thanks very much.
Thank you, Mr. Hirsch. I'm just going to check the hands up function to see if anybody has any questions for you. Seeing none. So thank you very much for attending tonight and sharing your view. And next up is Everett Latulippe.
Hi, thanks for having me. My name is Everett, and I'm speaking here today as an individual calling on the City of Ottawa to support the motion for paid sick days for employees. One of the pressing issues that COVID-19 has unfortunately brought to the forefront has been that the access to paid sick leave is not a reality for many people in Canada, including Ontario. With the increased prices of housing and living, not to mention the lack of employment due to the pandemic, Too many workers are forced to choose between protecting public health by staying home or going to work sick to support themselves or their families. The most recent data available, sourced from the Decent Work and Health Network, reveals that 58% of workers in Canada and over 70% of workers making less than $25,000 a year have no access to paid sick days. Workers without paid sick days are 1.5 times more likely to go to work with a contagious illness. Canadian research has shown that workers in high-risk settings, food handling, long-term care, and child care will continue to work when ill when they cannot afford to take time off. The Public Health Agency of Canada found that 50% of food handlers reported working with gastroenteritis, and US studies found that 41% of healthcare personnel reported working with the flu. After the H1N1 pandemic in 2009, a US study found that adults without paid sick days were more likely to go to work sick. A quarter of them stated they would not get paid if they stayed home, and 1 in 6 would lose their jobs. These gaps in paid sick days created major breaches of public health that exacerbated the H1N1 pandemic. Up to 8 million workers took no time off despite being infected, which is estimated to have caused 7 million additional infections among coworkers. Paid sick days have historically been proven effective in quelling the spread of illnesses in the workplace. Income and working conditions are the leading social determinants of health. Low-wage and minority workers who face greater impacts and barriers than the general population are also even more likely to be denied sick days. Those with public-facing and lower-income jobs are generally more at risk of getting and passing on communicable illnesses. It is especially concerning to vulnerable populations working in those jobs. Minorities such as disabled and chronically ill people or people of color who work in many of these higher-risk positions are disproportionately affected by the lack of sick days available and by the pandemic. The biggest outbreak in a single workplace was at a Cargill meat processing plant in Alberta, where Filipino workers earn low wages and have no access to paid sick days. Outbreaks on farms have led to over 1,000 cases and 3 deaths among migrant farm workers, primarily from the Caribbean and South America, who are denied paid sick days and cannot advocate for their rights due to fear of losing their livelihoods. In addition, disabled and chronically ill workers who need more sick days than the average employee in general run the risk of unemployment because they could not receive adequate accommodation for paid sick leave. A study in San Francisco found that workers with chronic health conditions alongside single mothers were the most likely to report needing paid sick days. I imagine that it would be the same case here in Canada. How do you keep a full-time job when you have regular medical appointments? How do you hold a full-time job when you have to take sick days that you are not guaranteed? The reality is that many bright and capable workers are being kept out of the workplace because of the barriers they're facing with paid sick leave and accessibility. It could be leaving those populations more dependent on government disabilities such as EI, CPPD, ODSP, or CERB to get by, which is extremely hard to qualify for. Well, at least EI, CPPD, and ODSP are, as far as I know, and also have an extremely long waiting period for approval. I cannot tell you how scary it is to be someone who struggles with my own health sometimes, that the day I call in sick could be my last day of work. The message from the public health agencies during this pandemic have been that people should stay home when sick and engage in physical distancing, but we need to put measures in place to ensure that people are able to do this without risking their livelihoods or careers. It is important to note that paid sick leave will most likely be unaffordable for struggling small businesses, but improvements should be made to the federal benefits to support this, including the CRSB. Paid sick days are a key component of decent work and key social determinant of health necessary for addressing health inequities. Paid sick days save lives. And most of this was sourced from the Decent Work and Health Network, who also have their own sources listed. And I did all my research into those. And that would be it for my points.
Okay, okay. I was just about to ask that.
You're on mute, Chair.
Sorry, Everett, I'm just going to see if anybody has any questions. I don't see anybody with their hand raised, but thank you very much for coming out tonight and giving us your perspective on this issue. Much appreciated. And next up, we have Heather Farrow. I see Heather's on the screen. So over to you for 5 minutes, Heather.
Hello, thank you very much for allowing us to speak at this meeting. And the previous speaker, I really want to commend her research. I don't have a written thing to read out, but I'm just going to speak from the heart. And I do want to say that I support Councillor Menard's motion for paid sick days to prevent further transmission of COVID. And thank you to the Ottawa Public Health Board for all you've done so far in Ottawa. But the City of Ottawa really needs to call on the Ontario government to immediately implement 10 days of paid sick leave for workers. And this is it really is a women's issue and a marginalized Ottawans issue. I think of friends of mine. I'm lucky to have paid sick days, but I think of friends of mine that don't have it. And some of them are working in more factory settings, close with other workers. And I know that people are working sick and bringing it home. This is how COVID is not going to be stopped. We already have a variant in the community. We already have problems with getting enough vaccines. We're hoping that the Made in Canada vaccine is going to come soon. It's not ready yet. The federal Canada Recovery Sickness Benefit, it's just not adequate. As the Unifor representative was saying, the wait time for it is a problem. And we need employer paid sick days that are legislated. And if that employer can't afford it, then they could apply for a subsidy. But the Loblaws, the Amazon, you know, these kind of companies should not be allowed to get the subsidy. They can afford it. So I really hope that this board is able to call on the City of Ottawa to ask the province to do this. And I want to thank all the members for all their hard work.
Thank you very much. Just to clarify, Councillor Bernard's motion is calling on the board to call on the province, as opposed to calling on the city to call on the province. I just wanted to clarify that. And let me just see if there are any questions. I see no questions, and thank you for coming out today. And as you say, from
Councillor Kavanagh has a question, Mr.
Oh, I'm
Chair.
sorry, Councillor Kavanagh.
Yeah, sorry, just got there. I just wanted to say thank you on raising the issue of on gender equity, because it is a gender issue, since the majority of these essential workers are women, a lot of them with small children, trying to hold things together. So I appreciate you raising that point. Thank you.
Thank you, and I thank you for coming out, and as you say, speaking from the heart. That's the best way sometimes, I think, oftentimes. So thank you very much. Next, we have Laura Sosnow. I hope I said that correctly. Close enough. You have 5 minutes, Laura. Thank you very much.
Thank you very much, councillors, and Ms. Etches, Dr. Etches, for having me. And I also just wanted to acknowledge that I'm speaking and we're meeting on unceded and unsurrendered Algonquin territory. I am a longtime Ottawa resident, and I've also had the pleasure of and privilege of working in a few other major cities in the country. So when I speak of my experience, I speak of my experience in Ottawa, but also my experience in other cities as well. For 17 years, I've worked dozens and dozens of jobs, most of them precarious, all of them pretty much minimum wage, from retail to community service to recreation to the arts. None of them have had paid sick days. I'm now 32 years old with 2 degrees. I'm a professional teacher within the Ottawa Carleton District School Board, and I have no paid sick days. Throughout my teens, 20s, and now my 30s, this situation has forced me to go to work sick multiple times, despite knowing that this is dangerous for myself, this is dangerous for my colleagues, and this is dangerous for my students. Rent has to be paid, bills have to be paid. There simply has not been any other option. During an out of control pandemic, this has gone from cruel to unconscionable. To be put in a position where anyone must attend work at all costs, ignore their bodily integrity and that of their families, and ignore good public health advice, which is to stay home when sick, is unacceptable. Remaining silent during a growing social movement for paid sick days for all workers, including casual, including part-time, and including non-unionized employees, sends the message that certain jobs matter less, that certain lives matter less, and certain people matter less. Unless this is OPH and the city's desired message, then they must course correct. and push more vocally and publicly for paid sick days so workers actually feel seen and heard by them. We are your jurisdiction. We are your constituents. We deserve a city council and a public health unit willing to work for all of us. I really appreciate your time. Thank you so much for having me here.
And we appreciate you coming out as well. I don't see any questions. So once again, thank you for coming out and sharing your story. Next would have been Linda Berry, but Linda has had some technical issues connecting with us. So, Deanne, she has shared with us some written comments you can share with the balance of the board.
Yes, Chair, they have been circulated by email.
Thank you. Our last speaker is, and I see she's on the screen, is Erin Cerrett. And Erin, I'll turn it over to you for 5 minutes.
Great, thank you. Thank you for allowing me to speak this evening. So my name is Erin Cerrett, and I'm a resident of the Somerset Ward, as well as a member of Horizon Ottawa and the Fight for 15 and Fairness movement. And I'm speaking in favor of the motion introduced by Councillor Menard, and I applaud his efforts to address the lack of paid sick days for working people in our city and our province. According to recent reporting in the Toronto Star, more than 7,600 Ontarians have contracted COVID at work. And I want to emphasize that it's more than 7,600 because this figure is in fact believed to be much, much higher. But this number itself is staggering and should alone have been enough to prompt our provincial government to immediately legislate paid sick days for all workers. But it hasn't. And so like the previous speakers, I'm going to take a few moments to remind you of the reasons why paid sick leave is so essential. COVID-19 has exposed many inequities in our communities, and one of these is the privilege that some workers have had in their ability to remain at home unexposed to the virus, while others, many of them low and minimum wage workers, have had to go to work every day and shoulder the risk of being exposed to the virus. These are the people who care for our elders, who grow and manufacture our food, who sell us groceries, who clean our hospitals, and who care for our children. They have been essential during this pandemic. We have even called them heroes. But when it comes to their working conditions, they have too often been treated as expendable. We know that the minimum and low wages paid to many frontline workers in this province is not enough to afford the basic necessities of life, housing, food, transportation, childcare. The workers in these jobs are disproportionately women, racialized and Indigenous people, as has been mentioned, and they cannot do what the Ford government has continued to repeat is the most important way to stop the spread of COVID, which is to stay at home. The vast majority do not have paid sick days. Not only that, because they are so underpaid, workers often have to hold multiple jobs in order to make ends meet, which creates the conditions for even greater spread of the virus. So what is a worker in such a position to do if they develop a cough or a runny nose, or maybe they feel more tired than usual? Why are we asking them to individually bear the brunt of what is a collective problem? I thought that we were all in this together. Why are we turning our backs on these workers who have been repeatedly praised for their work during the pandemic? Workers whose labor has been essential during this pandemic shouldn't be put in this position of having to choose between following public health guidelines to keep everyone safe and earning an income to keep their families securely housed and fed. When people go to work sick, they risk getting both their coworkers and the public sick. And increased illness also puts unnecessary strain on workplaces and on our healthcare system. Today, Premier Ford announced a lift of the state of emergency in the province and a reopening of retail services. He empathized with small business owners and the high number of people currently unemployed. These openings will mean an increased exposure to COVID on the job for many workers, and yet there's no mention of paid sick leave. Ford emphasized health and safety trumps everything in his government's approach to reopening, but that quite simply hasn't been true and is still not true. He also said he listens to the health experts in this province, province. He said that he does so 100%. Well, Ottawa Public Health has recently released these 2 reports on lessons learned in the coronavirus pandemic, and both highlight the role of paid sick leave in reducing the impact and severity of COVID-19 outbreaks. I won't go over what the reports say because I know you have access to them. But it is important to highlight that OPH has said that they've observed that staff continue to work with mild symptoms for fear of lost wages required to meet basic needs. And it's really important to note that infections can ripple throughout a workplace, and that can affect businesses' bottom lines through absenteeism and costly outbreaks. Ottawa Public Health is just one voice among many who are speaking out loudly in favor of paid sick days and has said they'll advocate to higher levels of government, and that is what you are being called upon to do as well. This motion does not call upon this board to reach beyond its jurisdictional powers to implement paid sick days. It very simply compels the board to advocate in the best interests of its residents by calling on the provincial government to use its jurisdictional powers to implement paid sick days. And this advocacy role quite squarely falls within the mandate of a responsible municipal government. So I call on you as our representatives to do the right thing. Your constituents need you to be a voice for bringing paid sick days, for bringing in paid sick days for every worker in Ottawa and Ontario. Thank you.
Thank you very much. I'm just, yes, our member Menard has a question for you.
Thanks so much, Chair, and thanks very much, Aaron, for being here and your well-researched background on the issue and excellent presentation. I guess one of the questions that comes up and sometimes people grapple with is whether the federal government should just do more and improve upon the current provisions that they have in place. What are your views on that, on a federal government sick leave provisions that they've put in place during this emergency versus the provincial government?
Yes, well, I mean, we've heard Ford deflect the question of paid sick leaves to the federal government, which is, I mean, it's convenient, I suppose, because it takes the responsibility off of the provincial government. But in terms of jurisdiction, working standards, employment standards are a provincial issue. They are legislated provincially, except for those covered under, for example, the Canada Labour Code. So it doesn't make any sense. The federal government isn't in a position to have systems in place for income replacement for workers in a timely manner. So this just simply delays the process. It doesn't actually address the problem. And what's crazy about it is that it would be very simple to bring in paid sick days at a provincial level. And we know that because it's already been done. That work has been done. And it's important that if a worker doesn't go to sick for one day, that their pay, they don't have to wait weeks and weeks to get that pay, issued from the federal government, which is the case, of course, with the sickness benefit that's been brought in. So it's a deflection, and it's really, it's sad because it just goes to show that the provincial government isn't taking this issue seriously. It has everything in its mandate and jurisdictional powers to address this issue and to address it immediately. Yeah, I appreciate you bringing forward the motion.
Thanks so much for those comments and for being here. Thanks, Chair.
Thank you. Those are all of the delegations on this particular matter. So I will open, I'll go through the list to see if anybody has any questions for Dr. Etches on her opening comments of the report, or if anybody wants to make any comments in relation to the motion itself. So we'll start with Member Tilley.
No question. Thank you.
Okay, thank you. And Member Pinnell.
No question. Thanks for the motion, Member Minot, and thanks for the presentation, those who came.
Thank you. Member Menard, do you have any questions for Dr. Etches?
No, just to say that the two reports were very, very interesting reads, and really appreciate the staff time that has gone into them. Thanks.
Thank you. Member Lakin.
Thanks, Chair. I don't have any questions for Dr. Etches, but I do have a question for you as to when in the process there will be questions regarding the motion that are not specific to Dr. Etches, but to the mover of the motion.
Now, as I said at the beginning, so any questions for Dr. Etches or comments in relation to the motion? So if you have any questions for Member Menard as the mover, now would be the time to ask them.
Okay, thank you. Then I will go ahead if I may. Member Menard, I believe therefore this is a set of comments related to you with respect to the motion on paid sick leave. I'll begin my comments by saying that in principle, this is a worthy motion and a worthy initiative. I completely support the initiative and the principle. Where I want you to respond and perhaps consider is in the complexity of the practicality of it. Recently, there's been a number of high-profile out-and-out violations of the public health orders regarding those orders. And what concerns me is about the implementation and the lack of language around that this motion would suggest would be no questions asked sick leave during a pandemic. And it leaves open for me the concern about what happens when those folks violate a public health order and would in turn be beneficiary of sick leave for doing so. So I'm wondering if you have any comments about making the motion more nuanced so that it could in some fashion contain language that sick leave is provided in good faith, or that it's sick leave in the case where public health orders are respected. And that would be the end of my comment for now. Perhaps I'd like to hear your response if you could.
Sure. Chair, okay to respond?
Question was directed to you, so absolutely. You're the mover.
Yeah, no, thank you. And I appreciate the question. I think it's important to recognize that the way the motion is worded is very much intended to be joining other boards of health across the province and advocating amongst common cause to the provincial government to get this started, to push forward with something like this that can get the ball rolling. And so that's why it's worded the way it is. In terms of your specific concerns, I think it is important to address them. So, in terms of people potentially violating stay-at-home orders and doing things that they are being told by officials they shouldn't be doing. The question then comes up is should we be means testing access to benefits based on the judgments of a recipient's actions or behavior? And I think you'll find that those same people that may be violating those orders and doing something they shouldn't may also be the same people that go to work sick when they shouldn't. And so I think for similar reasons as to why we shouldn't means test on people's behaviors, given that it's, I think, difficult public policy, creates unnecessary bureaucracy, wouldn't likely do the benefit that you're hoping it would do. I think the retributive policy tends to be less effective at changing behavior than addressing the root causes of behavior in the first place. And so I think it would be problematic and unmanageable to include something like that in here. And so I just would say I get the concern that you're raising, but I think that the reason the way the motion is stated as it is now is to join those other boards of health in an advocacy sense towards the province, which we need right now. So it's to keep that pressure up and just be open and honest with you about it. That's why it's come forward now.
Thank you, Member Menard. Any follow-up, Member Lakin?
No, other than to say that I appreciate the argument about how to change behavior. The reservation about that I have comes, as I said, not from the intention, but more from the concern that as a health body, making recommendations about economic incentives and or benefits does open up a can of worms that's effectively outside my pay grade and certainly is complex. And I want to recognize that with some kind of nuance that this is a health-oriented recommendation. In other words, it's intended to enable prevention. It's intended to enable infection control. And I don't want that to be lost in the motion. And I would like to have seen something more nuanced to reflect that.
Okay, thank you. Member Kavanaugh.
I want to thank my colleague, Member Menard, for the motion. I think it's important, and I really appreciate the support Ottawa Public Health has given indirectly in terms of pointing out the concerns of this and as a health risk. So I appreciate it and I plan to support it. Thank you.
Thank you very much. Member Gower.
I have no questions at this time, Chair.
Member El-Shantiri.
Thank you. Thank you, Mr. Chair. And question to the mover of this motion is this include all small businesses, doesn't matter the size of the businesses, like the mamas and papas shop? Is that will include everyone?
The provincial government will have the ability to say who it's not going to include, including whether or not they pay for those benefits for small mom and pops, for example, versus large corporations. That's the intent, and that's been the intent of other boards of health as well.
Would you be open for friendly amendment to exclude the small business have less than 5 people or put a number on it? Because there's a lot of regulation. It exclude the small businesses from being treated the same as the large corporation, because we heard earlier somebody said the Loblaws or Shoppers Drug Mart or other large franchise. I can see that, but it's small businesses where we heard from the Canadian Small Business Federation saying all across Canada, half the small businesses are either losing money or barely surviving. And what does that mean if you add more to what they've been going through in a time like this? So I'm just wondering if could that be, because in the past we've seen in a small business say no, business with 50 employees will be subject to public health contribute to public health insurance, or but I mean they put a number on. Are you willing to accept friendly amendment to put a number for the small business below perhaps 5 or 10 employees would be exempt?
The motion, I appreciate the counselor, the question, counselor or member El Shantiri. The motion, and again, the other intent of the Board of the Health is during an emergency situation, there would be 10 days of guaranteed paid sick leave, and that the province would have that authority and ability to pay for those through their own jurisdiction to those businesses. And so that I fully appreciate what you're saying. That is the intent of, though those businesses are struggling right now, the intent of the motion is that during those that sick leave that they'd have for those 10 days during a pandemic, during an emergency order, during a pandemic, that would be within a provincial ability to pay for that. And so I also just want to mention too, in terms of paid sick leave and the benefit to businesses, because there is a large benefit, Chair and Member El Shantiri. The Chamber of Commerce has recently come out in favor, has endorsed paid sick leave, and in December has endorsed a private member's bill that would guarantee workers 10 emergency days per year, and they say 7 of which would be paid. So the reason why they're supporting that Chamber of Commerce, which had reversed its position, is that they say that public health and safety are a priority for all of us. Ensuring that people, in particular during a pandemic, can afford to stay home is both the right thing to do and the economical thing to do. So it benefits our bottom line, our economy, and those individual businesses to have something like this in place. And I think, for that reason, I think we should pass this here today, just like other boards of health have been doing.
Thank you, Member Menard, and thank you, Mr. Chair. I would ask for ayes and nays when it's time to vote, Mr. Chair, please.
Absolutely, that's your right. We'll do that. Vice Chair.
So I'd like to thank, of course, the OPH for an excellent report, and of course for Member Menard for the motion. I guess I just want to focus on the health piece, because I think that is what we can endorse as the Board of Health. For me, I feel like the evidence is clear that from a health perspective, having workers need to choose between, doing the morally right thing and calling in sick and paying rent, that from a health perspective, that can sometimes cloud things, and that there's a health risk when that happens. So I'd support this motion from that premise. I can't comment on the economics of it all, and I would leave it to the provincial government in terms of how that's enacted. But from a health perspective, I'd certainly support. No further questions.
Thank you, Vice Chair. Next, Member Cloutier, please.
Merci, Monsieur le Président. No questions. Thank you.
Thank you. And finally, Member Banham.
Thank you. I like going last. It gives me time to put my thoughts together. It's great. So first, I want to thank our speakers for doing the research and sharing their personal stories. I think many people said it right when they said that this is a women's issue, it's a racialized issue, it's an issue for people who are differently abled, and definitely it is a mental health issue. I do think that it needs to be said that our board's job is to listen to the public when it comes to the needs of the health of the public, and we are there to protect the health of the public, or at least to support Ottawa Public Health in their work to support the health of the public. And I think if we're listening to the community right now, they're telling us very clearly that this is important to them. And so further to that, I think if we're honoring our strategic plan that we came together and supported, and we're honoring the principles of maximizing the potential in people, processes, and resources, if we're looking to drive prevention across the health system, if we're looking to promote mental health and reduce social harms, and if we're looking to influence social and physical environments and support the health and well-being of the population, those are the goals that we came up with together to support. And I think that it's very clear that if we're not supporting workers and their health, we are not achieving those goals that we have set forward. And I do want to talk about small businesses because I think it's really important that they receive support. And I do think that the provincial government will definitely need to focus on how they will support small businesses to achieve this. But I do want to say that I think it's very clear that many small businesses form family-like ties. And when one person gets sick, they do care about the well-being of their employees. And that for many small businesses, having somebody come in sick and spread COVID and leading to an outbreak would lead to a closure that would be even harder for a small business to shoulder the burden of. So I do think that that point needs to be made when it comes to the plight of small businesses and supporting small businesses and what they need to protect themselves so that they can continue to be open and work. I also think that it would be great for the public to know that small businesses and large businesses have employees that are able to stay home while sick. I think anybody who knows that somebody is sick while making their food would probably not want to eat there or shop there or whatnot, right? So I think having the support would actually give consumer confidence in businesses in Ottawa and the province. So for many of those reasons, I think we do need to lend our voice and advocate for paid sick leave for workers in Ontario. Thank you.
Thank you, Member Banham. Just a few comments. First of all, thank you to Dr. Etches and staff for this report. I think it's very comprehensive, and to sit down in the midst of the pandemic and try and learn from the pandemic at the same time was a significant challenge, and I think one that staff met for sure with this report. Very detailed, very thoughtful. The work is much appreciated. A similar motion to this came forward at council, and I supported that motion at council. I will be supporting this motion at board, but I just want to make a quick comment in response to something that Member Lakin raised. You know, I don't disagree that should the province accept the recommendation of this board and others across the province and implement paid sick days, that a few bad apples may benefit from this. Some people who gather when they shouldn't, or go on a trip that they shouldn't, and get sick. That may in fact happen, but I think we have to look at the greater good. And the greater good here, I think, is one of the pillars of public health, which is prevention. And to me, on balance, if something like this keeps a sick employee out of the workplace that otherwise would have gone in and potentially spread the virus to other employees, to customers, to diners, in a restaurant, for example, then that greater good for me, that tips the balance. That tips the balance. So if a few bad apples are out there and they benefit in some way, so be it. The greater benefit is to the general population in the spread that we can curb or prevent by giving people the opportunity to stay home when ill and still pay their bills. So I just wanted to put that on the record, and I will be supporting the motion. We've had a request from Member El Shantiri to have yays and nays on the motion. So I will ask the clerk to go through the list and ask for yays and nays, please.
Yes, Chair. Starting with Member Banham.
Apologies, I missed that.
Member Banham, your vote?
For the motion?
Yes.
I'm in favor. Yes, sorry about that.
Thank you. Member Cloutier?
Oui.
Member El Shantiri?
No.
Member Gower?
Yes.
Member Kavanaugh?
Yes.
Member Lakin?
Yes.
Member Menard?
Yes.
Member Pinel?
Yes, oui.
Member Tilley?
Yes.
Vice Chair Di Giovanni?
Yes.
And Chair Eglai?
Yes.
That's 10 yeas, 1 nay, Chair.
Member El-Shantiri, the next vote is on to carry the report recommendations as amended by Member Menard's motion. Are you asking for yeas and nays on that vote as well?
No, I will vote for the report, Mr. Chair.
Okay, so on the report, carried?
Carried.
As amended, rather, carried?
Carried as amended.
Okay, thank you. And again, thank you to public health staff for an excellent report. We received the report referenced in item number 6, and we also carried the report in item number 7. So I am going to ask Member Banham to read out the motion to adopt reports, please.
Be it resolved that the report titled Confirmation of the Chair and Vice Chair, the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled Lessons Learned Working with Long-Term Care Homes During the COVID-19 Pandemic, COVID-19 Pandemic Response, Looking Ahead and Building Back Better, Ottawa Public Health Strategic Plan for 2019-2022, 2020 Year in Review, and Ottawa Public Health submission to the Government of Ontario on 2021 budget consultations be received and adopted.
Okay.
On the motion, carried?
Carried.
Okay.
Thank you. I'm going to ask if there are any motions requiring suspension of the rules of procedure. Seeing none. Are there any notices of motion for consideration at a subsequent meeting? Okay, thank you. If Member Banham, if you could move the motion to adopt the confirmation bylaw, please.
Be it resolved that confirmation bylaw number 2021-1, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of February 8th, 2021 be read and passed.
Carried. Thank you. Are there any inquiries? Okay, seeing none, I am going to adjourn the meeting. Our next meeting is April the 19th at 5 p.m. Before we close and sign off, I just want to remind any media who may be waiting or watching this meeting rather on the YouTube live stream that we'll have a Zoom media availability 15 minutes from now. And so that would be at 7:45. 7:45. This replaces the post-media scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. Thank you very much, everyone, and we'll see you at the next regular meeting.
Thank you.